Hi and welcome to this Wound Hygiene Bite-Sized podcast. My name's Shelley Hawkins, Strategic Customer Engagement Manager at Convatec. During this podcast bite-sized series, we're going to be introducing you to Wound Hygiene, a simple 4-step protocol of care that anyone can do. For this episode, I'm joined by Jo Wilkins, Clinical Strategy Manager and Tissue Viability Nurse in the Northwest. And we're going to be discussing the dress step in detail, how we move from our holistic assessment through the decision-making process and deciding what dressing to use.
Hi Shelley, yes, and thanks for having me back for another episode. So thinking about the role of the dressing when it comes to the wound healing process. The dressing is there to support the journey. It isn't our dressings that heal wounds. That is, as you say, part of that holistic assessment approach. But the dressings help us manage wound bed symptoms. So through that holistic assessment, we can manage those symptoms with our dressings to help progress that wound back towards healing again.
And what types of factors influence the decision on what dressing we should use?
So there's many factors that we do need to consider, and this is why we have that systematic approach to wound assessment. So going through our holistic assessment systematically in a very thorough way, we can identify wound bed factors, so wound symptoms that will influence the dressing choice. So for instance, if we think about the exudate level that we're presented with when we're assessing our wound, if we have a wound with high levels of exudate, we're going to want to look towards a dressing that's going to help absorb and retain that exudate. Likewise, if we have a wound bed that's dehydrated, we're going to want to look to choose a dressing on formulary that is going to help rehydrate that wound bed, again to progress it towards the healing process. And that moisture balance is really important. Moist wound healing is an underlying principle of wound management. Other things we need to consider are our tissue types. So dressings can help us with the autolytic debridement process, so that removal of dead devitalised tissue from a wound bed. If the dead devitalised tissue is left on the wound bed, it can stall the healing process. And then we have to think about infection, so our microorganism or bioburden on the wound bed as well. Are we observing acute infection, or are we maybe observing biofilm that is on that wound bed? And again, that will lead us to select a dressing that will help us manage that bioburden on that wound bed.
Okay, perfect. But are there any other influences on the decision-making process that aren't directly related to the wound?
There are. The list does go on. So there's other things that we do need to consider. So moving away directly from the properties of the dressing, but looking at maybe the capabilities of the dressing in terms of its wear time. So if it's an adhesive dressing, we'd need to consider how adhesive is that dressing? Will it meet the frequency of dressing change? Will it stay in place and have the wear time that's needed? But also, is it going to be gentle enough to not cause any pain or trauma or skin stripping on removal for that patient? We also need to consider patient factors as well. So as part of our selection of dressing choice, we need to consider the patient's needs as well. So thinking about, are they wanting to change dressings themselves in between visits with a healthcare professional? Are they going to be able to do that? Is it a dressing that allows for somebody to self-manage as well?
This series has been all about wound hygiene. So when we're looking at a wound and trying to see if there's biofilm present, what type of dressing might we use, and how can we tell if there's biofilm there?
So again, as you've probably guessed, it starts with that thorough holistic assessment. So we need to go through that systematic process and look for those identifying factors that indicate that biofilm is a possibility. So biofilm isn't always visible with the naked eye, but there are other things that we can look out for within that wound that may indicate that biofilm is present. So if we have a wound that has not responded to standard care that we normally deliver, if it has not decreased in size, if it's showing the presence of devitalised tissue or increase in exudate level, This can all indicate at an early stage that biofilm is likely to be present. And if we think about our hard to heal wounds and the definition of a hard to heal wound, they're the things that we need to be considering if we have a wound that is non-respondent to our standard evidence-based care over a period of time.
And it's quite a short period of time, isn't it, that's the definition of a hard to heal wound not responding?
Yes, the evidence does suggest that we can identify this as early as day 3 of a wound being present. Now, that can be we've interacted with that person and we've witnessed that wound from that early stage, or they can give us the history of how that wound occurred and where we're up to date. Again, thinking about the information that we gather as part of our holistic assessment, those patient comorbidities and pathophysiology that is behind the cause of that wound can also strongly indicate to us that the likelihood of biofilm can be quite high. If we are observing this and we suspect that biofilm is present, and thinking about the body of evidence that we have that suggests there's around about 78% of hard to heal wounds have the presence of biofilm, we need to strongly consider the use of not just an antimicrobial dressing, but a dressing also with anti-biofilm properties in it as well. Fantastic.
Thanks, Jo. What other wound issues could we see in these wounds that might affect our dressing selection?
So alongside some of the symptoms we've already discussed, like exudates, devitalised tissue and bacteria, we can often get odour as a symptom as well. So sometimes we need to consider the use of a dressing that will manage odour. Exudate, if not managed well, or if we don't have a dressing that has the capacity to hold the level of exudate that we're having, that's coming from that wound, can often damage that peri-wound skin area as well. So that can be an additional symptom that we need to manage. So ensuring that you choose not only the correct primary dressing, so your dressing that is directly in contact with the wound bed, but your secondary dressing is equally as important as well. And as I say, that moisture balance is a really underpinning principle. So ensuring that your primary contact dressing is active and on that wound bed, selecting the appropriate secondary dressing to help manage your exudate levels is equally as important.
And those are factors that obviously hugely affect that patient's quality of life and managing those symptoms.
They absolutely do, yes. And trying to get the right dressing at the right time is really important. And thinking about what can that dressing offer you? Can it cope with or help you manage multiple different wound symptoms and factors all at once? And again, thinking about that patient experience and quality of life, by reducing the need to layer dressings can be a much more comfortable experience for the patient themselves.
Thank you very much, Jo, for joining us. In our next episode, we'll be welcoming tissue viability nurses from across the UK who will be sharing their wound hygiene stories with us. So please join us for the next episode.